talk a little bit about climate and some of the impacts that it has on human health, some of the challenges it poses, and how we can hopefully get around some of those challenges. So, climate impacts us as humans in terms of our health and well-being in a range of different ways, both indirectly but also indirectly as well. So it's not just about public health, but also agriculture. So in terms of public health, it can impact the presence of waterborne disease, the presence of vectors of disease such as mosquitoes, and it leads to increased costs to public health to look after the population. But in terms of agriculture, it can obviously have impacts on crop yields, which can have impacts on nutrition and human health in these sorts of ways. Forests, in terms of the products that we rely on from forests, forest fires, and some of the pollutants that occur during forest fires. But importantly, and I guess the two areas that we are most interested, or I am most interested, is obviously in public health protection, but also in water resources. So we're going to see changes in the variability, the distribution of water supplies, impacts on both the quality, but also in terms of increases in competition, and we're talking about towns, cities which are vastly expanding, and the impacts that that will have on those existing resources which are limited and finite. It also has impacts on erosion. We've been hearing about from Kifle in Ethiopia and some of the problems of soil erosion and impacts that that can cause. But we also rely on ecosystem services, those sort of things that enhance our quality of life as well. So it's very much the public health, water resources that I'm interested in. And this isn't just a problem that affects Nepal or Asia. It's an impact, it's a problem that's having impacts right now certainly across the UK as well. And excellent. Sorry. So yeah, it's having impacts as we speak, and that can be through diffuse pollution sources or point sources of contamination as well. And it's putting humans in contact with pathogenic microorganisms. And this is a display from the Natural History Museum in London, and it's an interactive model which demonstrates the fecal-oral route. And it's that transmission of microorganisms from feces back to humans that is what we are about in a large proportion of what we do as natural scientists as well. So it's trying to address and get over these sorts of problems. Okay, so our climate is changing, and we know that every degree increase in temperature is leading to about a 5% increase in the intensity of rainfall as well. So we're seeing more intense rainfall. Global warming continues unchecked. Summer monsoon rainfall in India and neighbouring countries will become stronger and more erratic. So it's not just about the intensity of the rainfall, it's about the changing patterns that we are seeing in terms of that rainfall, which is having unexpected implications on human health and our environments as well. And these are photos from Gularia, from the Bardia district. And it's a real problem, and it's affecting us now. And we were doing field work in Gularia during 2022, and this was an extreme year. We were there in June, and it was 43 degrees every day, and the monsoon rains didn't turn up. And then what we ended up with in September of that year was 160% of the rainfall as well. So it's that shift in the distribution and the timing of rainfalls and the extreme nature of them that is causing problems to human health. It's causing septic tanks to overflow. It's increasing the connectivity of surface waters and groundwaters. And that's having real impacts, not just in Nepal. But these are the water quality data from our field study in Luria, and hopefully you can see there is a difference between the two, between the dry season data and the rainy season data. And what we were seeing was a larger proportion of those water samples we were testing were failing. They were containing high levels of E. coli, which clearly pose human health risks. So we see this happening under normal monsoon conditions, but when it starts shifting, we see more intense rainfall, there's more energy in the system, in the planet, then we start seeing very poor water quality in our rivers and in our groundwaters as well, and importantly in our drinking water sources. So a large proportion of the population have septic tanks, or they're not septic tanks, they are ring systems. It's a single chamber, and the groundwater, which is already relatively high, increases, and we start seeing leaching of the pit contents, not only from the bottom of the pit, but through the sides of the rings as well, and we can start seeing further deterioration in the groundwater. And to become ill, we need to ingest an effective dose of microorganisms to overcome our immune systems. And what we're getting is a higher level of contamination, which means we're more likely to get to a point where we exceed our immune response and we end up becoming ill. And the results of some of the household sanitary surveying were questionnaires were showing that there was a reported incidence, regular reported incidence of different diarrheal diseases. These can be caused by things like rotavirus and other pathogens of concern. Other people were suffering from dysentery, cholera, typhoid. These are all waterborne diseases spread from human to human. But it's not just about rainfall. Climate is driving increases in extreme temperatures. And something we saw from the work in Nepal was extreme water temperatures, particularly in household storage tanks, in water that had been put through sand filters. We were seeing temperatures regularly over 30 degrees, 33 degrees, but up to as high as 36 degrees, so human body temperature. And increased temperature, although I've been having warm water whilst I've been here, when we were in the mountains before, has an impact on taste and acceptability. And what it can mean is that people start using less reliable sources as well. So it can have impacts in that respect. It also, importantly for us, it affects microorganisms. And if we've got water that is effectively at body temperature, the microorganisms from the human gut have evolved to thrive in those sorts of temperatures. So they can not only survive for longer periods, but they can also, importantly, they can start multiplying and regrowing. So it's this issue of temperature extremes can lead to further deteriorations in water as well. So it's something that needs to be addressed for a number of reasons. I guess what we've been trying to do with this project and what we're moving towards, particularly with approaches, including the golfer, is to try and make sure there is a multi-barrier approach, that we are not putting humans into contact with the feces. And it's not a single approach, so here we're stopping the fly from landing on the feces in the first place, but if it does, then it's not going to get any further, it's not going to land onto the sandwich. So it's about having a multiple barrier approach. And EMFO have introduced septic tank design standards, which are, if used, are going to help prevent that contamination of the groundwaters. If we see improved use of in-house filtration, whether that's reverse osmosis or sand filters, that is also a secondary approach. So it's a multiple barrier approach to protect human health. Seems to like that slide. Okay, so thanks for your attention. I'm obviously happy to answer any questions. Should anyone have any kind of posing, burning questions you want to ask, or things you're interested in knowing a little bit more about. Otherwise, thank you.